Welcome. I'd like to talk to you today about CS014 as a novel HDAC inhibitor regulating thrombosis without causing bleeding. Regulation of the human platelet is key to regulating thrombosis and preventing a myocardial infarction or stroke. We do this through inhibiting the platelet through a number of receptors. What has been targeted previously are the P2Y12 receptor, most notably through clopidogrel or Plavix, or the alpha-2b beta-3, as well as aspirin through limiting the thromboxane signaling. These have resulted in a 26% reduction in morbidity and mortality due to thrombosis. However, thrombosis-mediated cardiovascular disease is still the leading cause of death. Therefore, we must do better. In order to do better, we need to have new therapeutics that further decrease thrombotic events, but not at the cost of bleeding. What I'm showing you here is CS014. CS014 is an HDAC inhibitor. And what you're looking at in the top left is an in vivo intravital microscopy experiment. That is, we're looking at a clot forming in a live animal following induction of injury. In the top left, you're looking at a control condition. In that condition, we just have vehicle, and you can see that within 1 minute of injury, there's a significant clot that forms. That's the green. Those are the platelets. And underneath, you see a significant amount of fibrin, the red that is forming. However, below that, you can see an animal that had been treated for 5 days with CS014. Following HDAC inhibition, the injury is unable to induce a significant clot. There's very little platelet formation, if any, and no fibrin formation. If we look to the right, you can see the compilation of a number of experiments. This shows the reproducibility of up to 40 experiments for each condition, whereby you can see significant decrease in fibrin accumulation as well as platelet accumulation at the site of injury. In order to identify if CS014 works in large as well as small vessels, we looked at the carotid artery. When we occlude the carotid artery through a major injury, you can see that full occlusion occurs within 15 minutes in control conditions. However, animals treated with CS014 took an average of 25 minutes in order to occlude, and many of those animals did not occlude at all. We stopped the experiment at 30 minutes due to ethical issues, confirming that CS014 is effective both in small and large vessels in preventing thrombosis. Finally, we wanted to look at a low-shear venous system. So we did a puncture injury in the saphenous vein. And this is what we call a rebleeding injury, where we repeat this injury 3 times at 0 minutes, 5 minutes, and 10 minutes. And what you can see on the left is that at 0, 5, and 10 minutes on control conditions, there is a significant spike in the amount of platelets that accumulate at the site of injury. However, in animals treated with CS014, there is no clot formation. On the right, we look at fibrin. And again, you see significant fibrin formation in control animals, but not those with CS014. Finally, we need to know if CS014 is going to result in a diathesis or an increase in bleeding. We used 2 assays for this. First, we did the tail vein bleeding assay, where we resect the end of the tail of the mouse and identify how long it takes for the mouse to stop bleeding. And what you can see is there's no difference in bleeding time in animals treated with or without CS014. And finally, we looked at thromboelastography, a common tool and procedure used in surgery in the clinic. And what you can see is CS014 did not significantly increase the reaction time or the time to coagulation and clotting in this assay. However, rivaroxaban, a drug that is known to inhibit the factor Xa, does significantly inhibit reaction time. Further, rivaroxaban plus CS014 had no additional reaction time compared to rivaroxaban alone. So in conclusion, HDAC inhibitor CS014 has great utility, and we've shown this in both small and large vessels in the arterial system, as well in the venous system. Further, CS014 was shown to not cause an increase in bleeding risk, looking both at the mouse tail vein as well as thromboelastography. And so CS014 does represent potentially a new class of inhibitors in the prevention of platelet activation and thrombosis with protection from bleeding. And we can imagine this in a number of diseases, including myocardial infarction, stroke, DVT, and VTE. So I would confirm that CS014 represents a potentially new drug class for preventing thrombosis without increasing bleeding, and we're very excited to move this program forward. Thank you for your attention.